$400 billion, the American Job Plan isn't essential. We need it. And hopefully and prayerfully, you won't have to need it because you have parents, you have loved ones, you have someone that you know. I have a Down syndrome grandson. His mother has had to fight to keep her jobs because she's had to stay out of work to take him to the doctor. But if we had home health care that was proper, he would have a home health care worker that could do these things for her and she could continue to work. But we didn't have that. So she's had to quit her job and basically make do with whatever she can with his disability check. We know that doesn't go far. So with all of that being said, once again, I'm standing with all of the healthcare workers to fight for the $400 billion to be invested in healthcare for good jobs, proper PPE, healthcare benefits, paid time off, vacation time, sick time. When we get sick, what do our clients do? Once again, what do they do? Do we leave them alone to fend for themselves because there's no one else to take our place? Or do we bring our cold, our flu, our sickness into them and put them at risk? Right. We definitely need this home health care plan. So stand with us, fight for us as we fight for ourselves to make this happen. Thank you, guys.
Okay.
Excuse me, can I ask a question?
Just.
We are all state representatives, local representatives. Have you presented this case to the federal representatives? That's where the bill is. We can advocate to our congresswomen and men and senators, but the decision is being made right now in negotiation. Right now with
they know they know it's been presented, I'm sure. They know what's out here. We shouldn't have to stand and completely beg and plead for them because they know what's going on out here in these cities across the world. Yeah, these people are ready. We ready. If you want us to go in there and talk to them, we ready. We ready. We ready. Y'all ready?
We ready.
That's what I'm trying to explain to you.
All right.
Okay.
Samantha McLeod from Morganton, North Carolina.
All right. It is hot out here today, y'all. First of all, thank you guys, everybody, for being out here, especially these healthcare workers. My name is Samantha McLeod. I am from North Carolina, from Morganton, North Carolina, more specifically. And I have been a CNA for about almost 2 years. So I'm relatively new in the field, and already I'm seeing problems, and that's an issue. I work in a psychiatric facility, and ever since COVID has happened, I have worked the COVID unit, and I've personally cared for every COVID patient that my facility has had. But my home unit is geropsych, so that is your elderly patients that need long-term care, and they are suffering from a variety of physical and psychological problems. I'm here to tell you about the issues of understaffing. Understaffing doesn't just affect us, it affects our patients. So, as I'm talking to you about understaffing, I want you to imagine that you yourself need help. You are in a long-term care facility and you need a CNA to do everything for you. You completely rely on the care of the CNA. I want you to imagine that. So understaffing is a quality of care issue. When you're understaffed, it degrades the care that you are able to give to your patients. On the geriatric unit where I work, we are chronically understaffed. I mean, it's bad, y'all. There are 24 patients, okay? With our 24 patients, we are given 5 to 6 CNAs, and that's psych, and I'm going to get into that in a minute and how that's different. But on a typical 8-hour shift, you're going to be getting these patients in and out of bed. You're going to be bathing them. You're going to be changing their briefs. You're going to be assisting them with feeding and anything else that they need. You're going to have to take their vital signs, their blood pressures, and you're going to need to just pretty much be at their beck and call. So I have a patient who, after her showers, she likes to put her makeup on and she likes to put her jewelry on, and I love doing these things for her because it keeps her calm and it makes her happy. And I mean, I'm in healthcare because I love healthcare. I'm not here because I'm here for the paycheck. I'm here because I love taking care of people. This patient, sometimes I can't do these things for her because I am completely overworked and we're understaffed, and I don't have time. I have time to do the bare minimum, y'all. I have time to give her a shower and put her in her chair, make sure that she is clothed appropriately and comfortable enough to go on out, because I have to go to the next patient and I have to go to the next task. And do y'all know how hard it is to look at a patient and tell them, no, you can't have this, when they are saying, you don't care about me. I don't want to be here anymore. You're selfish. I'm tired of being here. I'm not getting direct care. That is so hard to hear because of how much I really do care. And if I could, I would do everything that every single one of my patients was asking. So you see, we're not just out here for ourselves. We're not just out here to put these benefits on us or to put money in our pockets. We are here for our patients. These patients don't feel like they are at home. Now, home health care, they are at home, but in a facility, they don't feel like they're at home. And this should be made to be their home, because this is where they're going to spend the rest of their life. I have patients that will apologize to me for needing attention. They will apologize for needing our care. They say things like, I'm sorry that I did this to myself. I'm sorry that you have to clean up after me. I'm so sorry. And that is horrible. That is heartbreaking. Nobody should have to feel like they're a burden like that. And that's hard on that patient, and it's hard on us too. We have more patients on my unit than we have staff. We have more patients that need to be fed than we have staff that are able to feed them. So if every single one of us sitting out here is a patient that has to be fed, and there are 5 staff, how many of y'all are sitting out here watching your food get cold, watching everybody else eat? And now I'm going to ask you a question. Are you still thinking about you as a patient? How are you going to feel? And then us as healthcare workers, how do you choose which patient to feed first? And how do you make that fair? How do you make sure that this patient doesn't feel like they're being neglected because of some reason, when all in actuality you just walked out the door and the first patient that you see is the first patient you're going to feed? How do you make that decision fair? So understaffing also puts an enormous amount of strain on us as healthcare workers. For a 12-hour shift, I work 12-hour shifts, I get a 30-minute break, that's it. And I feel horrible for even taking it. I go in late and I come back early because of the amount of work that has to be done. I will run to the bathroom, I will run to the break room to get a drink of water, and then I have to run right back out to the floor. I've actually had coworkers tell me that they wear briefs, adult diapers, while they are working because they don't have time to use the bathroom. Think about how uncomfortable that is, y'all. So you also hear the stories of the families, right? Because as a CNA, you sit there and you can listen in on these families' conversations when they're visiting with their patients, with their family members. And they say, the patient is telling them, I waited 30 minutes for somebody to come help me to the bathroom. I waited 15 minutes for somebody to come help me eat. And there was not any conversation. They just did it and ran off. And the families, what do you think they're going to think? That we don't care, that we're not doing our job right. And I'm here to tell you that the majority of the time that is not true. The majority of the time it's because we are so underworked or understaffed and overworked that we don't have time. We have a certain time limit that we have to get things done in, and then we have different patients that require different things. And remember earlier when I said that I work at psych and we have 24 patients for 5 and 6 CNAs? I am lucky. I am very extremely lucky to have that many CNAs to help me per 24 patients, because there are facilities out there that have 24 or more patients per one CNA. Right. One CNA for 30 patients, and you wonder why some of those patients stay in the bed, why they don't get out of bed, why they have bed sores, and why they're neglected. Because I work in psych, we have to have eyes everywhere. We have to have somebody covering every single inch of the unit that we're on just to keep our patients safe. And even those staff ratios are poor. That is horrible staff ratios. Understaffing is a safety issue, mainly. According to regulations, you have to have 2 people to operate a sit-to-stand lift. If you're not familiar with what that is a lift that helps a patient get out of the bed or out of the chair, and it has to be run by 2 staff members to be considered safe and legal. Because of understaffing, that doesn't always happen. If you are on the hall and everybody is busy and a patient comes up to you and asks, I need to use the bathroom. I'm about to have an accident and I need to go now. You have 2 options. Option 1, you can say, well, regulations prevent me from doing this. I'm sorry, you're going to have to wait. That patient can become incontinent, and that's probably going to make them mad, and it's probably going to create more work for you too. Option 2 is you can put the patient's needs above what your job is telling you to do and take care of the patient first, because that's who matters. These kinds of choices are choices that me and my fellow care workers are having to make every single day statewide because of understaffing. This leads to workers and patients getting hurt. So I started organizing with other care workers earlier this year, and when we talked about what needed to change in our jobs, understaffing just kept coming up. And it's probably because it is a widespread problem, and it is a problem that happens every day. Understaffing happens when decision makers prioritize profits over people. That's a way for those at the top to save money on labor. Yep. And that goes hand in hand with paying us low wages. Mm-hmm. Some employees at my facility are considered direct care staff, even though they don't physically work with the patients. They're in their offices and they're doing their jobs, and their job is important. But because they are considered direct care staff, they get put on our numbers as, hey, we have enough people to cover these patients, and it's not true. I don't see those people coming down and helping us.
They ain't.
No. So in North Carolina, there's actually not a staffing ratio mandate for nursing homes and for long-term facilities. It's left up to each facility to decide how many patients a staff member can take care of. Other places have passed laws on this, other states, and it's our turn now. We need to set a safe staffing level mandate in North Carolina.
That's right.
And us care workers need a spot at that table.
That's right.
Because we are the ones that it affects. We should be the ones to say what constitutes for safe working conditions, because we are the ones working them. Because as it is right now, none of us have a voice. We don't have a voice saying this is not fair, and a lot of us are scared to speak out about it, because whenever you try to say something about it, it's put in the trash can, or you're worried about getting fired. So I want to close by saying that I love taking care of people. That is why I'm here, and I think I can speak for all of my care workers when I say that we're not in it for the money. We can make a lot more money doing something a lot easier, and we're not going to stay silent about these unsafe conditions. We're not. We're here to fight, and that's what we're going to do. And one more thing that I want to put out there is, eventually, every single one of us sitting here is going to have some sort of care. You're going to need a doctor's visit. You're going to need a hospital visit. And you're going to hopefully not, but you might end up in a long-term care facility. Do you really want workers like us that are understaffed and overworked taking care of y'all? Do you really want that? Signing this petition, you are investing in your future health care. You are investing in your future care. Care workers, we are fighting for a change. We are fighting for a change. We're not talking about it. We're not sprinkling it on nothing. We are fighting for a change. A change for us and a change for our patients, and we need y'all to fight with us. Thank you.
All right. Thank you. Oh, what powerful stuff. What powerful stuff. These testimonies are very powerful. Problems of understaffing and unsafe conditions. Oh, wow. Powerful stuff. I sound like a preacher, don't I? Okay. Care workers are really putting their lives on the line to provide this essential care for everybody. And they're not always getting the PPE or safety training they need, along with being understaffed. So we have a question for our elected officials again. So, do you support giving workers a voice in setting better safety regulations? This includes North Carolina creating a safe staffing mandate for nursing homes and other care facilities. If you support this, please stand. We would like to give one more of our elected officials, thank you so much. We would like to give one more of our elected officials a chance to speak. The safety, please keep your remarks brief. More speakers. Oh, you, sir? Yeah. And who are you?
My name is Richard Watkins.
All right, go ahead.
We're just doing elected officials.
Elected officials.
Sorry, I was invited to come in and make remarks. Is that what I should do? At the end? So I'll sit back down. Did you want to go?
Yeah.
Go ahead.
Hey y'all, my name is Allison Dahl. I'm from Wake County. I am proud to have been a healthcare worker. I provided respite support, and I provided support to people with disabilities, helped them find jobs in the community, as well as finding life for folks that had been in and out of institutions and were then and got out and were able to live on their own with support. So I'm sitting over here nodding my head going, and it hasn't changed, unfortunately. It hasn't changed since I was 21 years old, and I'm 56 now. I started at 21. I think I got paid $10 an hour, but I lived in New York City. So I hear you. I will tell you that last year I sponsored a bill to do a study, which was the best I could do, to see if we could see if there was a need to have 15-minute breaks every 4 hours. Now, I don't know why we needed a study, but I couldn't get it in any other format to get it out on the table. I am no stranger to hearing that folks are wearing adult diapers because they don't have time to take breaks. We're here with you. I know everybody's sitting right out here as elected officials, and I know we're here with you. I know that we are frustrated because we don't have direct access to talk about this with, we can call our people, but we're not directly involved in it. But I also know we're frustrated because we present bills like Cynthia talked about, and we put them out there and nothing happens. So I really appreciate all the time and effort, and I don't want you to give up. I want you to keep on going because there are lots of people out there that need your support, and I probably will be one of them. So thank you very much for being here.
Hey, you sign it.
Oh, yeah.
Sign it. Yes, ma'am.
We all get to sign it, right?
Yeah, everybody.
And I've got to scoot. I'm going to a meeting.
Okay, thank you. Thank you. There will be a chance for other elected officials to respond. But now I want to introduce our last speaker, Reverend McAllister. Oh, that's you. Okay, come on.
Well, I want to say it's so good to be here with all of you in the fight for 15, and those of you who are working as partners with North Carolina Raise Up. You certainly have my support as a member of the governing board of the North Carolina Council of Churches and chair of our Racial Equity Committee, and also a minister of the gospel. I can profoundly see how important it is for all of us, including our legislators, who I applaud this afternoon for being here, when you could be doing so many other things, but you found it important to support this cause. And I certainly want to thank all of you for this privilege to share a brief word. And as I listened very carefully to many of the heart-wrenching narratives of not being able to take appropriate breaks, something that would be considered standard in the vast majority of employment opportunities. I find it necessary to ask you to think just a moment about the meaning and the significance of the word care. You know, we use that word on a regular basis. We use it not just in this context in terms of health care, but we use this word care when we talk about how we feel about our family members, or if some of you have ever dated, or if some of you have someone whom you love dearly, you might say to them that I care for you. And so we know the word care is part of the American lexicon. We know it's not a word that is strange to us. So the great irony that we hear this afternoon is a word that means so much to us, that bears so much significance, that bears so much weight and influence, is somehow forgotten when it comes down to health care workers and health care providers. I find it quite strange, and it makes me think of how important it is to remind ourselves that none of us would be here were it not for someone caring for someone whom we know. None of us would be here were it not for someone in the healthcare industry. And in fact, I had a grandfather recently who transitioned, and as I think about him, I think about those wonderful certified nursing assistants who would come into the home when family members would have to work extra hours, or perhaps would have to travel great distances and were simply unable to be there. How important it was for us to know that we had a qualified, dignified, and most of all, dedicated certified nursing assistant or home care worker to care for the one whom we cherished and loved and prized and valued. And so I'm here to say, as a minister of the gospel, that the question that lingers in my mind in all of this, be we Republican or independent or Democrat, is how is it that we draw from the essence of the deep well of sentiment that we speak of as care, when we diminish the value of care from the standpoint of those who provide and do and engage steadily, consistently, and selflessly, just like you do as workers. We need to respond to this paradox.
All right. Yes.
It is a great paradox. I think of a book written by Arlie Russell Hochschild when she talks about the great paradox being why there is this hatred of government among those who are most intensely in need of government services. And what I'm hearing this afternoon when we think about the American Jobs Plan is the great need to resolve this great paradox, because you are those who stand in need of aid and assistance from your government, not because you're asking for a handout, but because you are extending your hand and extending your service and extending your love and your care to all of us. So you're important to us. And just like the legislator stood here just a moment ago and asked you not to give up, I'm going to ask you also to continue this noble fight for justice, this noble fight for not just yourselves, but for all of us as American citizens and as North Carolinians. This is a valuable time that we're spending together that we should never take for granted. So I want to encourage you. This is important. It's important because as I think about healthcare workers, care workers such as yourselves are absolutely essential to the American way of life, and we should pay you and also have respect for you. Can I get some applause on that?
That's right. They need that.
Not only that, we must resolve this great paradox because care workers like you are engineers of society that help keep us all moving. We all pivot on the efforts that you make. Healthcare workers and care workers like yourselves are sometimes amongst the least regarded. However, you are crucial guardians of societal wisdom and well-being and comfort as you provide for those whom we cherish. I mentioned my grandfather, who was close to 90 years of age. There's a great deal of wisdom that came along with Reverend Joseph McAllister Sr. And when we relied upon persons like you, you were not just taking care of his body, his bodily needs, but you were sustaining his soul. And as a result of sustaining his soul, you were also creating creative space for those of us who would come behind you and oftentimes watch you and observe you and be able to benefit from that great well of wisdom that had been stored up in his mind and heart, and his capacity for sharing was amplified because of you. So we're grateful for you as care workers. And as I say this in conclusion,